And this will be a good trial expansion of the program beyond downtown and the waterfront. I want local councillor Mike Cole for bringing this idea forward. I sensed that the city was a bit quieter this weekend, and that reduced level of activity and contact wherever possible, together with...
They're going to celebrate the cancellation of the Spadina Expressway. I don't know what that means. They're giving all sorts of money to mental health agencies. Hey, that's Reconnect, CAMH, Pathways to Homes, who brought in... Keep it up, Chomo, who brought in the post of this building, crackheads' methods to attack me. I'm the one they tried to use as a guinea pig to get these drugs and programs in place. I am patient X for this place. So you're going to keep pretending you don't know me? When the cops, whoever shows up, you're like, oh, blah, 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 he's this is his name, and he's schizophrenic, and I know him from here, and I know him from there. And you don't know me. You just... All the things you say you know about me, you made up when you wrote them down, then you read them off the piece of paper you wrote them on.
There are 1,085 people in hospital. 231 of them are in the ICU. Sadly, I'm reporting
we got a lot of bad news today. A lot of bad news.
COVID-19.
Oh, let's jump right to the ending. You're calling in the Canadian Forces. You know what they're going to do?
Lives lost.
They're understaffed, period. There's nothing they can do.
Having crossed the 3,000 mark on Sunday. In the past 5 days, we have seen 6,090 new cases of COVID-19 and 418 people admitted to hospital.
How many days?
There are two stories unfolding at the same time.
The COVID is going away, but the variants are getting worse.
The unrelenting toll the COVID-19 variants are taking, and the success we are seeing in delivering vaccinations.
Because I got in the demons that are screaming out my lyric. And I'm new to this new game. Kids out talk shit. That's why I'm writing rhymes that even they can't fuck with. Let me do a show. Let me
improving and increasing.
What did she just say? All the in the healthcare system, blah blah blah, is increasing. Yeah, they just paid themselves for mental health. Remember that.
Each week.
All this money they're handing over for mental health, for the healthcare workers that work in mental health, they just paid themselves off your back for not doing the job they insisted you're not allowed to do.
Meaning the proportion of people who've received a first dose increased in all of the 13
None of this is relevant. So whoever the fuck's part of this Chomo net attackers for like 8 minutes straight trying to get on here. So you missed all the important. So that's okay. You can find John Tory, City of Toronto. What's today's date? 26th of April.
On Friday, the province's Science Advisory Table urged a focus on prioritizing vaccinations in places where rates of transmission are high. It estimated a focus on hotspot neighborhoods will reduce hospitalization.
Now remember, they've been insisting vaccines are a science all this time. They just figured out you should use the vaccines where the disease is. 2 fucking years of that. March 2019. We're now in our 3rd year of this. Oh yes, we are.
Of high risk. In terms of case counts, we will eventually trend in the right direction.
How do you know?
But we
what the Chinese guy say yesterday, or the Indian? I think it was a Chinese guy in India. You don't know it's a peak. I think it was Indian guy. You don't know it's a peak till after the fact. And what did I say? All these people get it. Oh, it's going to be a wave pattern. It'll come down soon. It'll come down tomorrow. Oh, it didn't come down. Okay, next week. No. Oh, it'll come down. For 4 months, they've been telling us it will go down. For 4 months, they've been telling us it will trend downwards. It's trending upwards. We had it at 80 cases a day. And what, 2 months later, it's in the thousands. And they're like, yeah, it's going down. It's going down. It's going down. From 80 to 4,000, and it's going down. Right. It's trending downwards. No, it's not.
There will be 4 full closures. Instructions to these organizations
full foreclosures
are underway.
Full
today.
Foreclosures?
Once they have received written notice, the instructions require immediate action. At that point, we will provide the names of the enterprises directed under the order.
They don't care.
We will begin to post business.
You know how I know they don't care?
Later today.
You can spot by the garbage all the brand name corporate logos blowing around on the ground. They don't care.
We will update business closures each Thursday on our dashboard, when we also publish the status of workplace outbreaks, unless there are circumstances where we need to provide public notification. I hope people find reassurance in the existence of
She's still trying to put out this fake emphasis. She went back to the fucking whatever. This is how you empathize and fool people. You must emphasize more, so they will care about you, and they will do what you tell them. It's no different than neuro-linguistic programming.
In that respect, there is a distinction between risks as it pertains to workplace closures versus public exposure that's worth clarifying.
Don't make no sense how it treats me.
Remember last fall that we issued.
Remember last fall, the numbers were down to 80.
People needed to know they may have been exposed at a place of business.
Oh, right. So the contact tracing means the business is required to tell you, or you won't get told. Not required, or you won't get told.
We've been fortunate.
The city of Toronto doesn't do contact tracing. They tell the sick person in the ICU to call up all their friends.
But it produces a
And
benefit.
then that person dies, all their friends die, and the city goes, gee, we don't understand. Why didn't he call?
And virus spread. The purpose of the new order is to separate people who may be infecting each other throughout the duration of the workday.
Infecting others.
And then taking those infections home.
We can't infect each other for both of them. You fucking don't understand the language you claim.
Spending the majority of their time these days.
It's not each other, it's others. An infected person can only infect someone else. They can't infect themselves. No one else can infect them because they're already infected, stupid. Jesus Christ. There was a lot more information when John Tory was talking.
So the priority, the real difference the order seeks to make is in getting employees apart first and reducing the threat of subsequent spread and serious illness to their families and those they see regularly where they live. Because the majority are working in places with no public access or public access greatly limited by the stay-at-home order or by operating requirements in place to support infection prevention and control. At this point in the pandemic, given the extent and the ease of transmission everywhere, I'm reluctant to characterize case counts as plateauing.
No
shit, the trending case counts, I am certain of this. While 13 or 14 or 1,500 daily cases is certainly worse than 1,000. 1,000 cases a day is never going to be anything to feel good about, and certainly not something that we can accept. If we are to bring the third wave under control, or have a real hope of the kind of summer we all crave, there is a lot of work to be done. The Section 22 class order is one targeted tool of many.
So you need to stop calling it a second wave, third wave, just like you need to stop calling collisions accidents.
The sum of the many parts that we draw on as we seek to blunt the impact of the variants and surging virus
That's what I was about to do.
In Toronto.
Thank you, Mitch. Blunt
hard work and patience, over time, we can all help to reduce the surge and restore true public health for everyone in Toronto. With that, I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila. Good afternoon.
Oh, that's good.
The City of Toronto operates a network of 9 vaccine clinics strategically located across the city. The 9 city-operated vaccine clinics include Metro Toronto Convention Centre, Toronto Congress Centre, Scarborough Town Centre, The Hangar, Cloverdale Mall, Malvern Community Recreation Centre, North Toronto Memorial Community Centre, Mitchell Field Community Centre, and Carmine Stefano Community Centre. These 9 city-operated vaccine clinics operate daily across Toronto, with people receiving vaccine from 11 a.m. through 8 p.m. 7 days per week. The 9 city-operated vaccine clinics operate on the basis of pre-scheduled appointments booked solely through the provincial booking system.
And that's the biggest bottleneck in your system, stupid.
Augmented by a growing number of hospital and Ontario Health Team partner-operated clinics, including both mobile and pop-up clinic locations. While the city-operated vaccine clinics operate solely on the basis of pre-booked appointments and specifically assigned appointment times, pop-up clinics generally do not.
What is up with the light, man?
Communities that pop-up clinics aim to serve, our community partners and local host agencies explain that many clients are not able nor comfortable in accessing online or telephone-based booking systems. Accordingly, pop-up clinics tend to operate,
which is precisely the problem with your system, stupid. What's the worst organization in the world when it comes to putting things on the internet? The province of Ontario. Absolute worst. The government of California is better.
Or involved in clinic operations builds both trust.
We've been waiting since 2014 for online social
vaccination partners and local community
welfare and stuff.
Who are working.
We've been waiting since 2003 for electronic health records in our hospitals. Oh, you think they have electronic? They're not standardized. They're not standardized. All your medical records are written down on paper. You go to a different hospital, they don't know who the fuck you are.
I know that the present environment can be both confusing and hard to keep up with. Most recently, I spent a considerable amount of time this weekend doing my very best to respond to resident questions and concerns.
Something G, something grams.
And through our media partners. I appreciate everyone's interest, engagement, and patience as we all work to respond to questions and inquiries in as timely and effective a manner as possible. We are working hard to coordinate and streamline all the available information on a daily basis, and to keep this information up to date on the toronto.ca/COVID-19 website.
Sewage in the hallway, thanks.
While the booking system for each of the city-operated vaccine clinics is consolidated into one single point of access, many of our partner-operated clinics do not use the provincial booking system for their respective clinics.
Why would they?
Likewise, pharmacies also do not use the provincial booking system.
This guy works for the city.
As such, we encourage.
Remember, 311 will not contact Toronto Fire Services about fire code violations, even though you're reporting them to the city.
Toronto.ca/.
Remember, I've been calling them for fucking like 6 months about this shit at least, straight, like longer than that, but they will not do anything about fire code violations.
And the relevant pharmacy website for appointments in pharmacies. I'm very pleased that yesterday we were able to open another block of vaccine appointments in city-operated clinics. This block of appointments is available between May 10th and May 16th. More than 60,000 individual appointments
has been run over before.
These appointments became available in the provincial booking system yesterday, and I'm pleased that 8,230 people successfully booked their vaccine appointment yesterday alone. As of 1 o'clock this afternoon, another 5,500 people have booked their appointment to be vaccinated against COVID-19. The eligibility for booking vaccine appointments is determined by the province of Ontario. At present, the following groups of people are eligible to book their appointment for COVID-19 vaccine in a city-operated clinic. Anyone who is 60 years of age or older. Anyone who is 50 years of age or older who lives in one of the identified hotspot neighborhoods. Anyone who is pregnant. Any elementary or secondary education workers who work in a COVID-19 hotspot in Toronto. Any elementary or secondary education workers who support students with special education needs, and any elementary or secondary education workers who live in a Toronto hotspot. Residents who are 60 years of age and older, along with residents who are 50 years of age and older and who live in
all this is 6 months now, this shit. Trying to make 2 out of 1.
Online booking system
We don't have enough doses, so we're going to do it this way, and that way, this way.
6488.
I'm not 100% sure what this is, except for brass.
Those who are pregnant are not yet able to use the
It is not
online
threaded,
booking system.
and it does not appear to be two parts. I don't know
These
what it
folks
is.
should call the provincial call center in order to book their vaccine
Something like
appointment
a valve
in a
or something.
city-operated clinic.
Valve stem or something.
The number of appointments that are made available in city-operated vaccine clinics corresponds directly with the number of doses of vaccine that are available to be administered. Last week, there were a total of 76,050 doses
but it does have a picture of a flower on the
Toronto by the province. 69% of those doses were administered in the city-operated vaccine clinics, with the remaining 31% being administered by our hospital and Ontario Health Team partners. This lower than expected supply of vaccine was the result of unanticipated vaccine supply chain issues. This week, a total of 107,640 doses of vaccine have been allocated to Toronto. In support of the ongoing sprint strategy that Dr. DeVilla and Mayor Tory announced last week, 59% of the total available vaccine is being allocated to our hospital and Ontario Health Team partners, and in support of hotspot mobile and pop-up clinic operations. Next week, Toronto is expecting to receive a total of
PRK, not LASIK.
297,730
PRK, that's
doses
right.
of vaccine.
Same as fighter pilots and boxers get. That's right.
As planned. 73% of that total will be allocated to our hospital and Ontario Health Team partners in support of hotspot mobile and pop-up clinic operations, with the remaining 27%, equaling 80,730 doses, being allocated for use in city-operated vaccine clinics. The province of Ontario determines eligibility and sets the parameters for booking appointments via the provincial booking system. We are in ongoing discussions with our provincial counterparts with respect to opening the provincial booking system to a wider group of residents. While those details have yet to be confirmed, we expect that the eligible age ranges will again be lowered moving forward. As vaccine availability begins to increase in May, we are prepared to both expand the number of appointments that are available in city-operated clinics, as well as to increase the number of doses of vaccine that our hospital and Ontario Health Team partners are able to deliver via their mobile and pop-up clinics as well. These mobile operations will be supported by our expanded mobile operations teams, comprised of firefighters, and physicians, working under the leadership of Toronto Public Health and the Sunnybrook Centre for Pre-Hospital Medicine, and in collaboration with our Ontario Health Team partners. This will further assist some of our most vulnerable residents, such as those experiencing homelessness, those who rely on our shelters, drop-in centres, and those living outdoors. Our Ontario Health Team partners, in collaboration with Toronto Public Health, will determine the locations that our expanded network of mobile teams will serve, along with the means by which each mobile clinic will be scheduled, booked, and communicated. This will ensure that we are best able to meet the unique needs and circumstances of each specific neighborhood and population that we serve. Thank you for all that you do to help stop the spread of COVID-19 in our city. In closing, please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunization in Toronto. Thank you.
My monitor has the monitors built in, and that's how I monitor the scanner that scans the monitor.
Please unmute yourself so we can hear your question, and we'll go first to John Chidley-Hill from the Canadian.
So, the university-mandated leave of absence policy was approved by the Governing Council in June 2018. The controversial policy allows the university to place students on leave if they pose a potential threat to themselves or others, or if they are unable to fulfill essential tasks required to pursue an education due to mental health-related issues. Yeah, so they tell you what disease you have and you can't go to school no more. So I've carried a knife every day of my life since I was 8 years old. And every time these people see me, oh, there's a nigger with a knife. A nigger with a laptop, a nigger driving a car, a nigger with a cell phone, nigger with money. nigger with jewelry. We can go on and on and on. Oh, was he talking?
This would be.
I'm not interrupting nothing because this speech started with, we're giving all sorts of money to mental health so the mental health workers can get mental health support for themselves and get paid to counsel themselves. Thank you.
It's most acute and it's consistent with science advice.
No, it's not.
We've all been
consistent
receiving,
with science advice. You mean
scientific
advice, scientific-based advice? You fucked up the language, bro.
Dr. Davila, hang on a sec there, John. Dr. Davila wants to have something.
Sorry, John, you were on to the next question, but I just wanted to add to the mayor's comment that certainly following the evidence and the advice that's coming from the science is the right thing to do. I do think that we have seen the Science Advisory Table provide their assessment of the literature and the evidence that exists.
Their assessment
that actually
of the literature and the evidence.
Neighborhoods can be
I think there's 3 qualifiers. That exists. Is that 3 or 4 qualifiers?
And deaths, and that's certainly something I think we can all get behind.
Remember, they wrote the evidence that exists. What they believe is what they're calling evidence in literature.
My second question for you is, you mentioned that there's going to be a total of 12 closures announced later today of workplaces, 8 partial, 4 full. I was wondering, are you surprised at that number of workplaces that will need to be closed in some capacity? And what kind of impact do you think this will have on Toronto's infection spread?
So, John, it's a new process that we're undertaking. I think we're all learning as we're going through. Didn't really know what to expect out of the gate, but certainly are hoping that it's this kind of targeted measure in concert with others, people following the self-protective behaviors, people sticking by the stay-at-home order as much as possible, and of course for people to go and get vaccines as soon as their turn comes up. It's the whole suite of these activities that we're hoping will make the difference, help us reduce the surge that we're seeing now, bend that curve, and really get us to the other side of this pandemic. So we're looking forward to seeing how our public health measures taken all together hopefully have that effect sooner rather than later.
Okay, thank you, John. We'll go next to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. Dr. Davila, I'm just wondering if you could just explain a little bit more the difference between a partial shutdown and a full shutdown of those businesses that are being under the Section 22.
Sure, Matt, I'll do my best to do that, recognizing that each circumstance will have its own unique characteristics and findings, and it will depend on the specifics of the investigation. But the notion here is to try to focus the application of the order in a manner that actually reduces the risk. And I think the way I would describe it is that, it right sizes the solution or the application of the order to the circumstances that you see. So there's an investigation that has to occur in the case of these workplace COVID-19 outbreaks and clusters. And what happens is that the investigator understands and works with the workplace to figure out what's happening, tries to determine where the transmission seems to be occurring. And if there is a particular area that's affected, sometimes it's a section, sometimes it's a team, sometimes it's a shift. If the action that's required in order to reduce the public health risk and the risk of transmission, it can be that specific or that focused, then that's exactly what we're going to do. If, on the other hand, the nature of the investigation is such that there is evidence of a broader transmission risk happening, then that's the kind of thing that will lead to a full closure. Or if, in fact, the physical space or the layout of the workplace is such that the whole place is affected, then, of course, that would also require a full closure. The point here is to try to provide the most focused application of public health tools in order to address the risk that's seen in that workplace.
Sorry, and to follow.
I'd just like to add to that, I want the public to know that Dr. Davila and her team are spending an immense amount of time informing themselves about, it's a complicated matter, the different industries, the different workplaces. If you just think about what was just said in terms of shifts and physical setups of different places of work.
It all fits on 1.5 pages.
By that, because, well, I have no doubt that the right and balanced
it all fits on 1.5 pages,
which is her responsibility.
All these businesses are so different, and they're all regulated by the same set of rules. One set of rules
from their medical officer of health and from their governments, which is that these things are done in the best interest of public health, but they're done.
Hey, remember when you forced the chink to knock down his whole house because it was like 16 inches off? Remember that?
Okay, now my follow-up for Dr. Davila. I'm just wondering, I know you're not releasing the names yet until you serve them with a notice, and I know this is a relatively new procedure that you're working with.
None of it's, no, it's not. No, it's not.
Through the course of the investigation.
130 years Toronto's been here. One of the things they do, shut down the 8. That's
the businesses that are affected by the closures. And
sorry,
the 12.
88, 98, 18, 30 years before Spanish flu, the city's founded.
A little bit more about what you're seeing there.
It's not a new procedure at all. They've been shutting down businesses for public health for a long time.
I will tell you this, the investigators working on these situations
it's so new, we don't know how to do it.
To appreciate the circumstance.
This person has worked their entire career for the fucking corporation that wrote the rules. And I don't know, it's hard to study. You've got all fucking day to do nothing but your job in the workplace. I don't know. How come I know you can shut down businesses and you don't?
What our investigations reveal, and then using
our
those
investigations
lessons learned
reveal.
and the findings from investigations.
There doesn't have to be an investigation first. The place gets shut down. Then investigations happen. It's always how it goes.
At the end of the day, what we're trying to do in public health is actually prevent, from transmission risk from happening in the first place. So, as we become more skilled in this new practice, we'll certainly use our findings from investigations to inform our own investigations and as well to help our businesses implement infection prevention and control measures to stop transmission risk from happening in the first place.
All right, thank you. We'll go next to Mark Douglas from 680 News. Mark, go ahead, please.
Thanks, Brad. I think I've unmuted this properly. A question for Dr. Davila. Thank you. Question for Dr. Davila. Between the 8 partial and the 4 full closures, how many workers are impacted here? And when you consider whether or not to impose one of these Section 22 closures, do you have any option? Is there any room or wiggle room to even consider the mental health aspects of what it would mean for the affected workers to send them home, and they're going to lose some wages, they're going to be idle for 10 days?
Are you
I don't know if that is something that
it's a 14-day incubation period. I thought it was 15, but it's 14. 15-day incubation. Yeah, that's the other thing.
So, Mark, thank you for the question. I think
14-day quarantines, 15-day incubations. Remember that they first started saying it was 15. Now it's 14. When did it change, bro? I forgot about that.
I'm sure we will, over the course of the investigation, come to appreciate that shortly.
We will come to appreciate that.
I would say this. When it comes to making these
ask her what appreciate means. Shouldn't even go up in value.
Exercising authority.
To show in your mouth, with your face to me, how much you need me. Get the fuck out of here. I hope she drops dead of this shit. I swear to God, I hate these people.
Our goal is to reduce transmission and to reduce the risk posed by COVID-19.
Okay, we all know that. That's assumption number 1 of this situation. Can you answer the question asked?
Appropriate questions raised by members of the public.
Appropriate.
The notion here is that we're really trying to
because she gets to decide what's an appropriate question, what's not an appropriate question, while she's injecting you with something that she will not disclose the contents to.
So our sincere hope is that in doing this, we are able to control risk sooner rather than later, that we are able to use the findings from our investigations to better support our work to reduce risk, but as well to better support employers, businesses, and other organizations throughout the city so that they too can work with us towards controlling COVID-19 spread. I mean, there's no.
By the way, if you think the journalists are saying things informally, like they don't know the proper words, it's because these people don't know the proper words.
Not only good in terms of limiting
do you have discretion?
COVID-19,
for
but
example,
also has clear health benefits insofar as we can.
They're in the wiggle room. They have to do that because this woman won't fucking communicate properly.
Including regular business operations as soon as possible.
Regular business operations. What's that mean? Because you have the right to make money, and the citizens owe it to you to spend their money there.
But on a different topic, if I may. Sunnybrook Hospital has dedicated 10 beds in a mobile unit to ICU care, and at least one patient has now been admitted. Do you believe Torontonians?
Hey, can you get the adults out of Sick Kids Hospital, please? We didn't donate money for adults to get treated there.
Hospital resources from perhaps unexpected.
And it's not suitable for adults.
ICU care. And are you aware of any Toronto Public Health resources that could
a 13-year-old girl died of COVID? Right. You're going to put the most infectious fucking people into a hospital where the kids are the worst case scenarios, don't have another option to go to a different hospital. You're bringing the most infectious people into the hospital with the weakest of the children. And you think it's okay. You think it's okay. That's pedophile mentality. That's right.
People seek and
kids are here to serve adults. And if you have ever yelled that, you must have been raped in the ass a whole bunch of times and let them. And you're probably about 89 right now. Because we've heard it all from the 3 generations after yours. Hey, everything put on my plate, including cardboard and mud. Wow.
Sending them good wishes.
That's why you're sick, yeah?
As well as good wishes, I should say, to those.
It's also why you're fat, diabetic, and alcoholic.
And certainly working as best we can to try to prevent.
Bread turns to sugar in your stomach. Sugar and alcohol are the same fucking thing.
With respect to what resources we might be able to provide to intensive care.
In fact, they've normalized it now to where they put sugar alcohols into food. It's an alcohol in food listed on the ingredients.
We certainly are supportive and seek to do our best work. Our best support, really, for healthcare is for us to prevent cases of COVID-19 to the greatest extent possible.
Then why? If you're wasting the orange helicopters transporting patients from hospital to hospital all over the fucking province, why do you have adults at Sick Kids Hospital? Why do you have adults at Sick Kids Hospital? Oh yeah, I have every right to be pissed off. I should have been in there getting treated for sickle cell 25, 35 years ago. Right.
Thank you. We'll go next to Natalie Johnson.
That's the gangbangers around who they would donate money to. It's not going to be some regular hospital. Maybe Sick Kids. Yeah.
This question is for Dr. Davila, and I think Meritori wants to weigh in as well. I'm wondering if you can speak to the issue of vaccine clinics in workplaces. The province announced 2 weeks ago that workplace clinics would be part of the hotspot immunization strategy, but
no, phrasing it like that puts all sorts of technicalities and things in the way. If they have a van pull up in the parking lot of the workplace, there is nothing to ask about.
Strategy to not divert some of the existing supply to
not divert some of the existing supply.
You're quite right. Supply is.
She didn't say stock. She said supply. Supply means it's still in someone else's hands coming to you.
Of the science advisory table, the provincial COVID-19 science advisory table.
And believe me, your water supply.
The resources that we do have
is before the water meter.
Exactly.
Then the pipe goes in your house.
Speak about our hotspot strategy. You heard me mention that as well. And the advantage that there is to having this hotspot strategy, first and foremost, it's supported by the evidence articulated by the COVID-19 science advisory table. And I would further say that it provides us access to essential workers. So vaccines are being provided to essential workers in those neighborhoods where they live. And the bonus to that is that we are then simultaneously able to provide that protective benefit of vaccination to those with whom they live, right? So it's essential workers and their households that are being covered through the current approach. Of course, as supply becomes more available, we can then start to explore what other avenues there might be that we would pursue to help get vaccine to essential workers all around the city.
I should just add to that, Natalie, I think you'll be aware of the fact that we did indicate our intention to pilot in a couple of workplaces, but this is really, again, constrained by supply. I think the model that they're using in Peel is interesting, and we might want to take a look at that, but all of this is predicated on having adequate supply, and for the moment, I think we've made it very clear that our priority has to be on the hottest of the hot spots, and we're making huge progress with that, as evidenced by the numbers that we've talked about today, and we'll continue to do that, but we did indicate we would explore workplace vaccination when supply permits and when we can find the right way in which to do that.
When supply permits, right. Supply is not your stock, it's what somebody else said they're going to bring you.
The city's top doctor says Toronto Public Health is putting together closure orders for a dozen businesses which are dealing with COVID-19 outbreaks. 8 businesses will need to close partially. 4 businesses are facing full closures for at least 10 days. We'll have the details coming up at 3.
News time, 2:50. What does it mean to be exceptional? Take Two company.
She was going for a fucking year. I can't even make the sound she was making. For a fucking year. By the way, if you're working from home or if you're working in a modern building in a modern city, go fucking clean out your fucking sinuses. If you took a shower today and blew your nose once, that shouldn't be happening. You understand? That shouldn't be happening. Spit into a bucket on the damn thing. You do that 6 times in a row in one 60-second piece, and it's the same fluid going up over and over and over. Blow it the fuck out. Hit your fucking sneeze button and sneeze, stupid. Jesus Christ, these people are disgusting. And I don't mean the noise makes me feel sick. What I mean is they keep sucking it back into they're doing everything they can to make as much of a mess of this as possible. All of them are. All of them are doing as much as they can to make a mess of this. We're going to give all sorts of money to mental. How about the so-called signal upgrades to the subway? Remember, they're not allowed to go past 50 kilometers an hour no matter what. So the only way you're increasing capacity, not speed, there's going to be more trains because there's going to be one in the station, one sitting in the fucking tunnel with no ventilation. No, there won't. The trains moving through the tunnel moves the air up, and you notice when the air blows up from those grates in the sidewalk, you probably don't realize it, but it sucks back down a second later, or blows, but it pushes back down a second later. That's what ventilates those tunnels. There's no fans. There's no powered fans. Why would there be powered fans? That would imply they knew what carbon monoxide was. The city, the TTC, Toronto Transit Commission, had no policy on running internal combustion engines in the tunnel because they weren't supposed to be running internal combustion engines in the tunnel, ever. Pressure washer. Yeah, in this fucking book here, a tunnel would be a confined space, wouldn't it? You can't run anything that's fuel burning in a confined space where there's humans, like as a workplace.
The story isn't over. No time to be idle. Every game, every play, every...
No time to be idle. Yeah, never idle.
Sportsnet. Your next report is at 3:01. Now with the forecast, here is Denise Andriachi.
Well, it's a nice sunny day, but yep, it's below seasonal. We're tapping.
But yep.
Overnight tonight, some showers develop, and they could hang on through early Tuesday morning. And then we should just be mostly cloudy tomorrow and cool, again, below seasonal. We'll have more steady.
What the fuck just happened here? What did I just kick that made a noise like that? Oh, well. Sewage. I can't believe how bad it smells in that fucking hallway. It smells like fucking sewage. Potentially that could be a dead body, but I don't think it is. Don't think it is. So they may or may not tell us they should be telling us in about 10 minutes.
Just get milked.
Child thinks I swear to God I should be there from all the pills I took, but I'll be.
So that's not appropriate for advertising. It's not appropriate for advertising at all. And an insurance company would know that. Insurance companies, funeral homes, and banks cover all the bases. Milking a dude? Yeah, I'm not fucking mentioning what that is. That's disgusting that I have to keep hearing that. I'm not on a porn site. It's broad day on the radio. I shouldn't have to hear that. You want to go milk a dude? Buddy, get the fuck away from us.
It's a throwback. Yeah.
Fuck, disgusting. Remember, these same people, that generate the guy talking and the generation of people that would be in charge of this marketing are the same generation that told my generation at the age of like 10, you should try gay. You might like it. Niggers are bad. Weed is bad. Crack is good. You're like, wow, these guys are fucked up. That's who's throwing blood in my face and chasing me around the building and things. But I'll let you know, half these people died in the last year. So I ain't worried about it. All your friends are dead. All your friends are dead. Was it worth it? Was it worth it?
Chop walks, keep on that chop links. I swear to God, I should be there from all the pills I took, but I'll be okay.
With the Oklahoma 47,
raise your hands if you're going insane. If you're feeling so depressed, you want to blow out your brain.
It smells like fucking sewage in that fucking home.
But still, you try to keep it moving, they're probably the same. I used to get high like trucks on lift kits. Then I woke up and I said, fuck this shit. I made a promise to myself, man, rip shit and slide to your verse like a Tokyo Trippz kid. From being at the doctors on pills like please help me to being on the hospital floor like please kill me.
Oh, so Chomo tried to hit me with a ladder today. He keeps doing things like they do to children. He said I'm not a child. Like he's got a ladder and he swings at me, and I'm supposed to go and start crying. Don't hit me. But I'm not 3 years old, stupid. You've been stalking me since I was 3. That doesn't mean I'm 3. And when I don't react, of course, there's babble goes on. Now I got some idiot that's lived here about a year telling me that I don't live here and he's gonna knock me the fuck out and blah blah. White guy. They're all fucking white. Oh, this one looks white. That's what I mean. They're all white. Not one of them is black. A bunch of them are East fucking Indie. They're then half white. They're not black. This is the shit that it's not that I put up with. This is the shit that happens. Don't kid yourself. You got sickle cell, you got mixed blood, though there are people out there that will try to kill you. They've been trying to kill us off for about 7,300 years. Yes, you have. Yes, you have. You can be black if you choose to, because white people get sickle cell now too. No, they don't. You will find the comments on video. Oh, see, you don't have to be black to get sickle cell. Really? Because that person's black, dumbass. Everybody wants to tell everybody else what they are and are not, because they know by looking. Okay, I'm gonna point something out. No matter what people it is in the world, even if they're purebred, breeding, true, whatever, go back 3-4 generations, look at photographs. They don't look the same. They're not supposed to. So if you think looking at me, you know what it means because you were taught this and that about the traits I cover up. I'm not covering up because I'm ashamed. You can tell from everything about me what I am. The only thing that'll throw you off is the hypopigmentation. Go look up a picture of an Afro Dutchman. You'll find the same painting that's in the window of the Academy of Art Canada. It's a picture of me, but the skin is slightly browner. It's I don't know how to explain. It's because there's 6 types of melanin. It's not the same type of melanin East Indian people have. No, it's not. That's a different kind of melanin, stupid. And I do not have neomelanin, the red one. You can see the blood in my tissues because there's no pigment. There's very little pigment anyway.
Making another move today. This Reddit, the favorite stock of the Reddit trade crowd is up almost 11% at 160.
I had to reshuffle.
9K to 9, there's nothing to inherit, and I hold on to keep my money, including my parents. I'm trying to set the right diet.
Seeing it stock jump 25% after Wedbush upgraded it to outperform. Here's an SP, the online craft retailer, falling 93%.
Yeah.
On some negative comments from an analyst.
CH.
Negative comments of an analyst. Which analyst and what comments?
Trouble never trouble you. Shouldn't never trouble, and trouble never trouble you. Never trouble you.
There's a war going on outside, no man safe from my rusty outside. Said he seen this shit from day one. Politicking, spilling on my conscience, young nigga. Where the head up botanists, we do this shit regardless. Keys to your garden, homie, what you guarding? Picking up my checklist, switching up my weapon. Afraid of rejection, so I keep it in the barrel of my magnum. Bullets penetrate through cars when I blast them. It's the club party hard VIP section. Do a show with the crowd, GSC reppin'. OT, blue flag, now everybody's cousins. Real bad boy, you get beat down in public. Police don't stop shit, black on black, they love it. Rather just
brothers and blood cousins.
Pala black seed in the trees is Camalado.
I am trouble with Ferus, never trouble them, never trouble them. I am trouble with Ferus, never trouble them, never trouble them. So make them come ready for them, come ready for them. Make them come ready again, come ready again.
Hey, yo, my style is impeccable. Niggas better notice on my Mike Tyson shit. Flow so ferocious, I will eat these MCs. There are not up in my league, I'm in the better category of the highest of degrees. The shit that I seen, the shit that I dreamed, we out here stand steady, try and fill up the team. Better be aware your surroundings are end up in the box, lost and never found, kid. And that's life. Pay the price. Don't act like you might lose just tonight. Don't think twice, get what up nice. Never drive by. Be on the execution style. Up close and
yeah, keep freezing it up, Jomo. That's good. Makes me look too stupid to hold the camera when you're doing it. All right.
And it's two to go. All my enemies, I think you should know.
I am trouble with Ferus, never trouble them, never trouble them. I am trouble with Ferus, never trouble them, never trouble them. So make them come ready for them, come ready for them. Make them come ready again, come ready again.
So practice what you preach, preach what you practice. I'm known to punch a rapper, your camera, understand spits, time for a change. Can't leave things as is, words numbered. I don't relay no man's bliss, tight slip, tight like a vice grip. I might flip, half nuts, kamikaze.
The buyers are on a made, but they're selling this stuff. I'm not made by that shit that you. Keep it up, Jomo. Keep it up. Keep it up. Every time my face turns towards the screen, it's gonna lock up and twist my neck and show me edited eyes and all that shit. I don't care, bro. Keep it up. Keep it up. Keep it up. You couldn't be more fucking. You see how I predict you? You see how I push your buttons? You do everything I fucking say you're about to do, right? Yes, Jomo. It's going up and down. It's going up and down. That's so impressive. If I was 3 years old, that might fucking get my attention somehow. I'm not 3 years old, stupid. 3.5 decades has passed. You're still stalking a 3-year-old in your head. Yep. Keep it up and down, over and over. And if I go over to my cell phone, it's going to be going in and out, in and out. What kind of subtle fucking hint is that? You paid money for that software, stupid? Keep it up. Keep it up. Yeah, see, I keep calling what you're doing before you press the button, bro. You know that, right? Or just after, but before I can see it, if you want to. You done, stupid?
Your next report is at.
I'll put it to you this way. In the morning, when I end the video, he's downstairs in 5 minutes. Every time. So if you're looking for him, never mind. Who would look for a piece of shit like that?
7 downtown with that sun. We'll have the clouds build a little bit, and just around midnight, we'll
you're
have
not
some
predictable.
wet weather move into the region overnight and through Tuesday morning. And then most of Tuesday should just be cloudy. I don't think we're going to carry some precipitation throughout the day necessarily. But
so the funny thing is, he'll walk up to people he doesn't even know, and then point at me and start telling them things about me. But every single person he does that with is white, and those white people don't know me. They've seen me around 10,000 times because I grew up out here. 40 years of me being out here. But I don't talk to white people. So these white people think that guy's crazy. They know he's a pedophile. They all know it. Ask all the old black ladies, all the old ladies, not by any color. All the old ladies, because it doesn't matter once you get to a certain age. Who the fuck this guy is? They'll tell you. One look at him, they'll tell you we struggle.
And so we'll be covering both those this afternoon. And so with the numbers and some comments, I'm going to hand things over to Dr. Yaffe.
Which one's Yaffe? Is this provincial?
Thank you very much. Good afternoon, everyone. Since the last update,
what type of bullshit are you asking?
These two, the municipal and provincial, these female heads of the public health, I can't stand them. I don't care if you emote or not, if you can do the job. They've both spent the entire last year trying to empathize more. Spitting on the fucking mic, you can hear it. Try to, you need to care about me. Why? I don't fucking know you.
Niggas demons in my mind need to lay off from attacking me. Make me blast the heat. Midday catastrophe. I am trouble with furrows. Never trouble them. Never trouble them. I am trouble with furrows. Never trouble them. Never trouble them. So make them come ready.
I'm gonna point out one more thing. So they've got so many distortions and lies going around. It's crazy. Some of you are white South African, not the viewers. Some of these idiots that harass me are white South Africans. Okay, I couldn't give a fuck if you're white South African. I know a lot of bad things happen in South Africa, but since I didn't grow up in South Africa, and there's like 4 generations there between so I'm the 3rd gen. I'm getting into too many details. Dutch people went to South Africa. Yeah, did a lot of bad things and so forth. Yeah, I know. But they speak Dutch there, but they call it Afrikaans because it sounds different because it was picked up by drunken sailors. So I know you white South Africans think you're better than me somehow because I'm the half-breed. First of all, a lot of you white South Africans got some black blood. Yes, you do. I can see it in certain things about your features. I'm not white South African. There's no white South African in my bloodline. We're Afro-Dutch. That makes a bunch of people just started laughing. We're a royal bloodline, and you're scum that was discarded. But you keep telling me I'm garbage, eh? You're nothing in the world, bro. Where's The Hague located? When something bad happens, it's not Dutch people getting dragged from the Netherlands to South Africa to face war crimes tribunals.
That is the highest positivity rate.
10.9%. You can find all these details. I lit the joint because I thought the other one was done. So.
Come ready for them, make them come ready again, come ready again.
Oh, and being born physically in Canada or within the geographical boundaries doesn't mean I'm not Dutch or Dutch royal family or whatever. You can read all that however you want. The princess was born in, I forget the name of it, but in a hospital in Ottawa, in a room that was declared by the Prime Minister to be Dutch territory. So the royal bloodline continues. If all the other nations around say, yes, you are the official government, you are the official royal family, it doesn't matter what the idiots that try to kill you say, as long as you win the fight in the end. She was born physically here. She's Dutch. Queen. You understand that? So I'm still a negus being born here. In fact, because I'm mixed with certain particular races, one of the things nations will do when they make a treaty, they'll intermarry. So I am the living treaty. It's like a wampum belt, a woven belt, where the threads all go around and around, just like a DNA strand. Oh, double helix, not a single helix. Which brings you to the hair that looks like DNA strands. No, it's not tangled, it just looks tangled. Oh, is that tangle? Is that a tangle? No, not technically. Oh, well. I thought we were going to get the regular news. So we, unfortunately, I guess we missed it. I heard the, this just in. So about an hour ago, this just in. About the Canadian Forces.
Xavier.
I should explain. So when I'm speaking colloquially, it's easy to say this. I'm not saying white South Africans are garbage or not garbage. If you're going to play the game of one is better than the other, what I actually am, instead of what you're calling me, in your worldview, is considered higher. So I'm not saying anybody's garbage just from where they're born or the DNA. That's not what I'm saying. But it's very easy when someone's attacking you. It's very easy to refer to them as their race or nationality, and that can lead you to starting to hate those people for no good reason.
Where the rubber bands at? Got 100 grand. Where the rubber bands at? Where the rubber bands?
Down to my boxes, ASAP, rock in. I handle all of y'all problems. I've been down now. On top of me, I was Gucci. More low, movies, low, it's your hoe. Like, oh no, she go low, yo. I've been running around in six, nigga. Running around saying rich, nigga. Spitting shit bigger than a nigga could be slinging switches. Trying to get the 6 figures, the 6 nigga. Once I get a little bigger, I'ma flip the script, nigga. Got 100 grams of rubber bands, I bag it up and go and hit the strip, nigga.
Rubber bands at? I got 100 grand. Where the rubber bands at? Got 100 grand. Where the rubber bands at? Got 100 grand. Where the rubber bands at? Where the rubber bands at? Where the rubber bands at? Got 100 grand. Where the rubber bands at? Got 100 grand. Where
My rubber pants at? I got a monogram.
Where the rubber bands at? Where the rubber bands?
So when I tried starting this, I just heard 2 big news stories. We got these 2 up there. All last week I couldn't tune in on the right time to get these. So 2 o'clock and 3 o'clock? No, 4, 3, 2 o'clock. I saw a T-type today. It may have been no, it's a G. The ones with no badges are GNX, right? New York Grand National.
This car, it came out of nowhere.
So they're all black.
Did you get the license? No, it happened so fast.
If I remember correctly, it's a 3.8 liter turbocharged V super whatever the turbocharged V6. And they didn't release the official power numbers back in the day, but it was said to have like the high 300s of horsepower, or 400 or something, 380 horsepower, something way up there. I don't quite remember all that. I just remember they didn't tell us all the details back in the day either.
Futuristic gamma gangsta lean tactic gamma target bag galactic sonic wheels bionic mobiles transmitted admitted you couldn't get it till I split it in 2 and wasn't with it till it attacked you. Infatuation, verbalization, spit at you. Duck the oral boomerangs back to smack you. Raw with disinfectiousness. Ironic sky spring like mattresses. In fact, this is bionic Oldsmobile. The sonic wheels like Panasonic. We play this on Alpine units and bomb with critical napalm fluid. Platinum wrap, plutonium liquid. See how the flow leaks out the tap like water. Mega verbal slaughter. Silk simp, cheap, sick and sharp in the sea. You touch me, you catch the charge from the energy. I'm blessed with tremendously hot spit. Straight out the cockpit, distracted, clock tick, then fly. The vocab is mad, but take a listen to the way we
around with the Glock kids.
Receiving treatment
around with the Glock kids.
So we know that there's many reports
around with the Glock kids
that may cause concern around the AstraZeneca vaccine. But as you know, we have recently had a further update from our National Advisory Committee on Immunization that has lowered the age down to 30. Still in Ontario at this stage,
some kid got murdered in Alberta like 2 months ago.
Issues that we only have so much to utilize, and we want to get that age group done.
I think a 14-year-old just got booked for murdering a 15-year-old in Vancouver. Is that what just happened?
Individual case-by-case basis. So these reactions are still rare, as we talked about.
You people would lock a child up for the rest of their life for that, and I would say your whole fucking society needs to be locked up if that's happening.
We've given about, actually administered 650,000 doses of the COVID-Shield or / AstraZeneca vaccine here in Ontario. So we are continuing to monitor the situation. We're continuing to document these, to investigate them, and in partnership with our federal, provincial, territorial team, we're looking at those on a national basis because we want to be advised if there's any undue concerns. We'd be letting you, the public of Ontario, know and advising our healthcare committee and our physician committee accordingly in that. And so we are doing this not because we feel that they're unsafe. They do have a slight risk, a low rate risk, very small compared to some medications.
Well, you're guaranteed to have health
and
problems
very
from
low
formaldehyde and
compared to getting
mercury
COVID
and
and the
aluminum and all that.
complications of COVID. So we still want to encourage everyone, when is your turn or opportunity to get a vaccine, to obtain the vaccine and to have that administered, especially during this immunization week, because already we're seeing many strong indications of the benefit of the immunization as our case rates in the older population groups, those over 60, definitely those over 80, and our death rates have come down, as well as our hospitalization rates in those age groups are coming down. So it shows you that the vaccine is working, and so we are hoping, and our plan is to have by the end of this month, or the 1st of May, 40% of our eligible population vaccinated with it, and that will be a huge achievement and one we're looking forward to. So the messages are, get vaccinated when your chance is an opportunity to have one, and continue following the public health measures, because we need both going strong together. And I think we're seeing evidence of that turning. We have to continue to drive it down even further in these weeks ahead, because we still have our high admissions to the intensive care units. That is the delayed metric that will continue to accrue, unfortunately, over the next week or two, until we turn that one around for the solidarity of our healthcare system, as we help our frontline workers deal with this very huge load, and as we help them try to get those case numbers down again to relieve the pressures on them and on our healthcare system. So with that, I'm going to hand over to the media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the
So I can tell the difference between
from John McGrath.
Keep it up, Chomo.
with TVO.
I'll wait a second. So I can tell the difference between the different types of coughs people have, because my own. That's particulate matter, and a lot of it.
Vaccinated, and
perhaps some type of chemical or everything.
Probably going to get to at least half, and then 100% hopefully people eligible by July or so. But
you're driving me up the goddamn hole with this vaccine. There's so many more important things to be talking about right now.
How people who are partially but not completely vaccinated should
have changed the equation from where we were a year ago or even 6 months ago. And so just a list of these ominous types of telltale signs that maybe we're further away from pre-pandemic life than we are closer to it. I see that the vaccines are coming.
That's how time
in,
works, stupid.
Week, it's going to be 2 million
At least
plus,
I think that's how it works. The time is all in our head anyway, right? That's what they tell us. Since my watch got fucking stolen
there's
by
more
the cops.
vaccine buy-in now, especially from younger people, given that these incidents are obviously impacting the younger demographics.
It's a $300 watch. Like, it's not, they can't.
Rap there for
I don't understand. Why would you steal a $300 watch for a cop?
To accept AstraZeneca. But let me just
it wasn't a $50,000 watch.
Because this 13-year-old
it wasn't a $2 watch, $20 watch either.
To this point now, they say
what the fuck's wrong with you?
8 people who have passed from COVID are under the age of 20. There are 8 people under the age of 20. Does that give us pause, or is that a rounding error, given that we died?
And there were 2 kids at Sick Kids Hospital that had it. One of them died, and they're saying they didn't die from COVID. You want to bet that's not a contributing factor?
But is it done
for all these adults? They say that the other things were comorbidities that contributed to COVID. Keep it up, Jomo. That contributed to COVID killing them. For the kid, they say the other thing killed them, and COVID didn't have nothing to do with it.
Now, whether there were any other contributing factors, have not seen that in any of the reports, because the headline seems now to blare at us and be almost the entire story. And so we react or respond viscerally to that.
Well, the more lines, you get less lines to type,
the more headline. Question as our lead item. I'm really, really curious if this is a sense of perception that we. The alarmism is warranted. What you're hearing out of India, for example, and some people are saying, "Hey, we're not immune from that kind of thing happening here."
It's the equivalent of the entire city of Toronto getting sick over the course of the last.
Close the border to these international flights.
Somewhere between 1 and 3 weeks.
Our province, as well as Quebec, asking for these third countries as well, which are maybe way stations for people coming indirectly from India, not a direct flight per se, because it can't anymore for 30 days. But, maybe landing somewhere or flying in from Frankfurt, Germany. The province is weighing in, and actually we're going to hear from Dave Piccini, the MPP for Northumberland, Peterborough South, who's telling us why they petitioned the federal government to close even that loophole. That's an important one that needs to be addressed. We don't need these mutants or double mutants now, triple mutants being spoken of.
Triple.
I mean, how many iterations of this thing do we need? And this is where it frustrates the hell out of me, because I thought we could have done a better job on the borders and the international flights well before Friday. But it looks like, you know, the narrative sometimes is entirely given over to, well, Doug Ford hasn't implemented these paid sick days. You know, the guy out in BC is an NDP premier. He hasn't either. In fact, he's been waiting on the federal government to come to the table and close that loophole.
Run EI, don't they? They ran CERB. They brought that out instantly. What the fuck is going on here? They're trying to fucking make everybody sick.
Different than Ford in that
They're trying to make everybody need the government.
A certain form of selective condemnation, I feel. However, here we go. I'm going to start with this one, the alarmism. Is it warranted? 10.9% positivity rate with